On this Thursday night, new details about Canada's new rapid COVID-19 tests. Ottawa just bought millions of them, so why doesn't everyone want one? Plus, parts of Quebec enter a partial lockdown. Young Canadians stressed.
It sucks.
And struggling to get by.
I work 7 days a week.
The financial pressures of the pandemic and the difficulty kickstarting a career. Allegations of rampant racism in Canada's healthcare system.
I don't feel safe going to a hospital as an Indigenous person, right? And even then as a doctor.
What needs to be done for real change? And some doggone recognition. New honors unleashed for BC's beloved top doctor.
Global National with Donna Friesen.
Good evening and thanks for joining us. We have been warned there is no quick or easy way out of this pandemic. That reality is hitting hard in Quebec tonight, where millions of people are back under tighter restrictions. Starting today and for at least 27 more days, a partial lockdown is in effect in 3 virus hotspots: Montreal, Quebec City, and the Beauce region. That means bars and restaurants are closed except for takeout, as are theaters, casinos, and museums. No park gatherings or visits to other people's homes are allowed. To help bars and restaurants get through the next month, the government is offering to cover 80% of their fixed expenses.
I know we've made some tough decisions in recent days, but there are lives in danger, and fighting the virus must remain our top priority.
Here's what's worrying. Quebec is reporting nearly 1,000 new cases today. Over the past 7 days, it's recorded an average of 793 cases per day. Here's the rest of the country. It's important to point out the Atlantic bubble is working. Just 1 new case is being reported in that region today, and some restrictions are now being eased in PEI and Nova Scotia. Alberta has 173 new cases today. BC has 82. Ontario has 538 new infections reported today. That's down from over 600 yesterday. But there is a problem. With more and more people in Ontario getting tested, the province's testing backlog is getting worse. Today, there were more than 82,000 tests waiting to be processed at labs. And now there's more confusion over who should be getting tested in Ontario. For weeks now, people were told everyone who wants a test can get a test, and kids who had even one minor symptom like a runny nose or sore throat often needed a COVID-19 test before they could go back to daycare or to school. Now, Ontario Public Health says that's not necessary.
We are changing the policy or clarifying that schools and daycares should not be requiring a negative COVID test. In fact, they shouldn't even require a doctor's note.
Now, rapid tests could, in theory, reduce the backlog and take some of the pressure off labs in this country. Health Canada has approved a handful of rapid tests, and the federal government has committed to buying millions of one kind of rapid tests made by Abbott Industries in the U.S. But Ontario's premier said today he doesn't want to rely on them. And as Abigail Bimman discovered, it's going to be quite some time before millions of these rapid tests are actually delivered.
In an interview with Global News, Health Canada's chief medical advisor says while the government bought up to 7.9 million newly approved rapid tests, we're not getting them all at once, and we're not getting 8 million anytime soon.
Hundreds of thousands of tests fairly shortly within this first few months, and then moving into, I think the total is close to 2.5 million tests. That'll take us into the early part of 2021.
Dr. Supriya Sharma says the tests will be doled out based on several factors: per capita case numbers, epidemiology of outbreaks, and the rural-urban split.
The provinces and territories are in the process of looking at what their needs are and submitting those to Health Canada. We haven't received those yet.
The Abbott ID Now is a PCR test. It works by detecting the virus's DNA. Back in the spring, the U.S. Food and Drug Administration flagged concerns about its high false negatives, and a New York University study found that a different rapid test, the Cepheid, performed better. The Trump administration is now deploying a different test from Abbott, the Binax Now antigen test, which is based on proteins.
What America has seen with Abbott and some of the other rapid tests in terms of high false negative rates is not acceptable. So as a result, United States policy has shifted.
The other announcement that the Prime Minister made about the Abbott testing, that's going to help. Don't get me wrong, but it's not the rapid test. I have confidence that they're going to get this out, and I really look forward to it because it's a game changer.
Health Canada says it can't comment on the American concerns and data from the spring.
The version of the test that we did see was supported with evidence to show that it was picking up cases, with the nasal swabs at a rate of at least 93%.
This test is not something that basically they've thrown at us and said, please here, take it, without any additional testing. They have provided all of the additional clarification after exposing some of those potential weaknesses.
And that other test, the New York University study found performed better, Cepheid, well, that's one of the few approved for use here too, and it's already in use, including in northern Manitoba. Canada has purchased about 1 million of those tests. Global News asked why not more compared to the 8 million Abbott tests. Dr. Sharma said it had to do with supply capacity, what the company was able to provide in the short term. Abigail Bimman, Global News, Ottawa.
Now to some other COVID-19 developments, starting with that outbreak at Calgary's Foothills Hospital. According to public health officials, a 5th patient has now died of the virus. The number of infections is going up. In total, 35 patients and 29 healthcare workers have now tested positive, and at least 290 other healthcare workers are in isolation. In Ontario, more than 140,000 personal support workers are getting a pay raise. The province has announced a $3 an hour raise for workers in nursing homes and home care and a $2 an hour raise for workers in public hospitals. It is worth noting, though, the raise is temporary and it's expected to end next March. It's also less than the $4 an hour pandemic pay PSWs in Ontario got earlier this year. That raise ended in August. In Manitoba, the federal COVID alert app is now active. Quebec is expected to roll it out too in the next few days. When Ontario first adopted the technology in late July, Health Canada was hopeful it would become widely used, but BC, Alberta, Nova Scotia, PEI, and the territories still have not given it the green light. Thousands of recent graduates are facing the end of a 6-month grace period on student loan payments. The federal government put a freeze on paying back loans and interest because of the pandemic. That ends today, forcing many young people to deal with a new wave of financial uncertainty. Mike Drolet reports.
All right, got my coffee.
Sean McNally has been singularly focused on his dream job doing animation in the gaming world.
Grab our brush.
The pandemic, of course, has put a lot of dreams on hold, and McNally now keeps his skills fresh animating online to an audience of followers.
You've got to be positive, otherwise people don't watch you.
But it's not easy, and even though the job market has yet to thaw, the freeze on student loans is over. So since graduating in the spring, he's struck out finding work, didn't qualify for CERB benefits, and his school bills have now come due.
Because of that, I'm going to fall even further behind, and it sucks.
The most recent StatsCan numbers show 23% fewer young Canadians are in full-time jobs compared to this time last year. Count Aisha Akaredi in that group. After her husband lost his job, she answered the call to work in a long-term care facility when few others would. But it's contract work, and far from the social services job she'd studied for.
I guess I don't have choice, so when the time comes, you know what, I don't really know. That's why it's really an hard time for me right now. I don't rest. I work 7 days a week, so I have to pay bills.
Unless Ottawa freezes student loan payments again, she'll have another bill on her already full plate. Her only hope for a deferral is if she qualifies for the Student Loan Repayment Assistance Plan. These pandemic graduates aren't unique to having a hard time launching their careers, but analysts say current financial pressures could see them stay in jobs they need instead of jobs they want.
You know, I wouldn't look down on anybody who's in that situation and say, when are you going to get started or get launched? Nobody should be putting judgment on these students. They have to do it a whole different way.
They have no other choice. Mike Drolet, Global News, Toronto.
This weekend, we'll find out who will succeed Elizabeth May as leader of the Green Party of Canada. 8 candidates are running, including a woman named Annamie Paul, who is Jewish. Her candidacy appears to have exposed what some say is a troubling anti-Semitic undercurrent in the party. As our chief political correspondent David Akin reports, it's not the first time the Greens have had to deal with this.
We will launch a plan to solve the climate emergency.
Human rights lawyer Annamie Paul is, by some measures, the front-runner to become the next Green Party leader. According to figures provided by the party, she leads all candidates in terms of fundraising and number of contributors.
We believe that we can win seats with integrity, with good public policy, with evidence-based public policy, and that's really what it's about for me.
But as popular as she's been with many Green supporters, others, she says, have attacked her for being Jewish.
I have been subjected to what can only be described as an unrelenting onslaught of comments and commentary and trolling online.
It's hardly the first time Canada's Greens have had to deal with the accusations of anti-Semitism within its ranks. In 2014, then-party president Paul Estrin, also Jewish, quit in disgust after being attacked by some in the party for condemning the actions of Hamas terrorists. And in 2018, the party's justice critic, Dimitri Lascaris, accused two Jewish Liberal MPs of being more loyal to Israel than to the Prime Minister. Lascaris' attack was widely condemned by all party leaders, though he rejects the view his comments were anti-Semitic.
Well, I think one has to really get a good handle on what anti-Semitism is and understand that legitimate criticism of the State of Israel is in no way, shape, or form anti-Semitic.
Lascaris is now a top contender to become leader of the Green Party, second to Paul in fundraising, in fact, and he rejects the idea that the Green Party has a problem with anti-Semites.
I think that there is a serious problem with anti-Semitism in this country, and I think where you're going to find that is predominantly on the right wing of the political spectrum.
Still, he's a contender only after overcoming opposition to his candidacy from party executives and from the last leader, Elizabeth May, who fired him as justice critic after his 2018 comments.
My views and the party's views are solid on this. I think, to the extent that anybody is running for leader of the Green Party of Canada who has expressed anti-Semitic views, they shouldn't have been allowed to run.
In allowing Lascaris into the leadership race, the party's governing council would only say that its, quote, concerns were satisfied and that it trusts in its membership. Donna?
All right, David Akin in Ottawa, thanks. The federal government is under increasing pressure tonight to clarify its position on Indigenous fisheries. A second Nova Scotia First Nation launched a self-regulated lobster fishery today. It's part of a new effort to assert their inherent right to fish for what's called a moderate livelihood. That right was upheld by the Supreme Court of Canada more than 2 decades ago. But as Ross Lord explains, there is still no clarity about what moderate livelihood means.
At the St. Peter's Wharf in Cape Breton, Indigenous pride is on display. A drum band performing the Mi'kmaq honor song, and the Grand Chief blessing a small fleet of lobster boats. This is the second Indigenous lobster fishery to launch in Nova Scotia in recent weeks. The Botlotec First Nation chose to do it on Treaty Day, which Nova Scotia designates for promoting public awareness about Mi'kmaq culture and rights.
It's an inherent right, we've been fighting for this for 20-some years and resistance every which way, so it's there's only one way to do it, and it's on the water.
The first self-regulated lobster fishery in southwestern Nova Scotia was met with heated protests and widespread cutting of lobster traps by commercial fishers, who insist everyone should fish within the same season.
You're racist. Just say it.
There were no immediate signs of protest this time, as a growing number of First Nations plan to follow suit.
Well, member too, Eskizoni and Annapolis, and I know a few other bands also looking at the same thing. We're all going to be using the same plan.
As the number of First Nations fisheries increases, so does pressure on the federal government to clarify whether it supports them.
I'd say it puts definitely pressures on your members of parliament.
This Cape Breton Liberal MP is also a Botlotec member.
And the reason why it's not clear, it's because there is not consensus within the Mi'kmaq communities or within the federal government of what a moderate livelihood means.
Jaime Batiste proposes establishing a new entity led by the Mi'kmaq community so all sides can reach a common understanding of how best to share what the ocean has to offer. Ross Lord, Global News, St. Peter's, Nova Scotia.
If it's not bread, then what is it? Coming up, an unusual court ruling in Ireland. This stunning footage is from California. This is what firefighters are facing as they battle what's called the glass fire just north of San Francisco. It's destroyed more than 22,000 hectares and it's burned down more than 200 buildings, including homes and wineries. It's only about 5% contained, and it's just one of nearly 30 fires that are still burning in California. At least 30 people have been killed and more than 90,000 people are under evacuation orders. Adding to the concern, more hot, dry, and windy weather is in the forecast. Well, it doesn't seem like there needs to be a legal definition of bread, but there is now in Ireland. The fast food chain Subway has been told by the Irish Supreme Court that its bread is not, in fact, bread. The case centers on Ireland's value-added sales tax. It, like the GST and the HST, is not applied to basic groceries, but does apply to snacks, junk foods, and candies. A Subway franchisee in Ireland believed the company's bread qualifies as a staple food and should be exempt from the tax. But a panel of Supreme Court judges disagreed, ruling that the bread Subway uses contains way too much sugar to be legally considered bread, which makes it more like cake, it seems. Still ahead, what Joyce Echaquan's video just before she died exposed in Canada's healthcare system.
You're watching Global National.
It was one of the last acts of a dying woman. The cell phone video Joyce Echaquan took as she lay in a Quebec hospital bed pleading for help has exposed an ugly reality Indigenous leaders say exists in our healthcare system. A second nurse has now been fired from that hospital, but Indigenous leaders say the racism Echaquan faced from the hospital staff is not at all unusual. It's that she managed to capture it on Facebook Live. Otherwise, her death would just be another forgotten statistic. Heather Urix-West reports, and a warning, some viewers may find the video disturbing.
Dr. Lindsay Croshoe is a family physician and a researcher at the University of Calgary. But
I don't feel safe going to a hospital as an Indigenous person, right? And even then as a doctor, when I was a medical student, there was this Indigenous woman. Yes, she was a drug user, and we needed to put a central line into her. And the doctor says she doesn't deserve anesthesia.
Croshoe says the examples of anti-Indigenous racism within Canada's healthcare system are so common that the disturbing video of Joyce Echaquan's final moments did not come as a surprise. In the video, the mother of 7 is in visible distress, while staff members can be heard making racist and derogatory comments.
It wasn't entirely surprising given what I've seen in the context of the review I've been doing.
Mary Ellen Turpella-Fond is a former BC judge who has been tasked by BC's provincial government to investigate Indigenous-specific racism within BC's healthcare system. The investigation was launched after disturbing allegations of racism in emergency rooms. So far, she's examined more than 550 cases, finding evidence that racism is pervasive, and she doesn't believe the problem is BC's alone.
There is a need for a national attention to it, and there's a need for leadership inside health professions.
When have I ever known anybody who's Indigenous to go into the healthcare system and have a good experience? It's rare. It's rare.
Senator Yvonne Boyer, who is Indigenous, says the work being done in BC needs to be replicated across the country.
Until we start realizing that there is a problem, then you can keep sweeping it under the rug, and there's going to be another 50 Joyce cases come up.
Because as investigations like the one in BC have shown, there have already been other deaths not captured on cell phone video. And without change, there will likely be more. Heather Urix-West, Global News, Calgary.
Next, navigating through 2020, grieving, building trust, and adjusting our mindset. Somehow it's become October of 2020, which means we're closer to the end of what will always be known as the year of the pandemic. We're learning to live with it, but there's no escaping its impact. Not only are more than 1 million people around the world known to have died from COVID-19, it has altered how all of us live. Tonight, Crystal Gamansing takes a look at the stress it's created and the toll it's taking.
COVID-19 is more than symptoms, spread, and the number of cases.
I think every person who dies of COVID-19 has a family, a community that they're associated with, and those losses are difficult. And I think loss and grief in the pandemic is something that's a very different experience.
Families haven't been allowed to say goodbye or even grieve in the same manner. More than 1 million lives cut short because of the virus, and it's likely the number of dead worldwide is higher than the official reports. The toll on doctors and hospital staff is immense.
I think in the ICU and in the emergency department, the teams are tired. They have been working tirelessly since the beginning of this pandemic. And as soon as we started to see a fall off in the COVID-19 numbers, we started to see a return of the non-COVID work that we all have to do.
With hospitalizations rising, restricting social interactions, wearing masks, and washing our hands are all more important than ever. Linda Bold is a behavioral scientist and public health researcher. She says people are tired, so buy-in will be even harder.
I think that a lot of people were naive about the fact that what was required for a pandemic is almost unprecedented intervention in people's daily lives. So the state having a very aggressive role and not considering A, how long that would be required, or B, the types of communication that were required to take the public with them and to build trust.
Following the advice of public health officials is the best course of action, especially as researchers urge the public to be realistic about when a vaccine will be widely available. Crystal Gamansing, Global News, London.
And that is Global National for this Thursday. I'm Donna Friesen. Tonight's Your Canada will melt your heart. Meet Bonnie and Henry, two guide dog puppy recruits. They're named in honor of BC's provincial health officer. The guide dog group says it's a fitting tribute as the puppies will grow up to provide the same kindness, calmness, and guidance as Dr. Bonnie Henry does. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.